Hi viewers, I'm Professor Dr. Nazali and will tell you something about stress and role of cortisol and corticosteroids or the naturally occurring steroids. Uh, in this materialistic world, everybody is suffering from stress. Now, before going into details of stress, let me proceed to tell you something about the basic of stress. Now, hormones. Hormones are chemical messengers which harmonizes the body's internal environment and brings peace and tranquility in the physiological function of the body. So they play a very vital role in maintaining the normal physiological functions. Any changes in these hormones, whether they are from the anterior pituitary, the posterior pituitary, they will produce to change the internal environment. Subsequently, that will lead to pathological disorders. Now, uh, we know that on either side of both the kidneys, on the top, there is adrenal gland where the adrenal cortex secretes different hormones, and they are divided into three different portions, where one is zona glomerulosa that secretes aldosterone, zona reticularis that secrete cortisol, and then it is converted into corticosterones. Sterones is the aldehydic or ketonic form, and the all is the alcoholic form, and this is converted into ketone through the oxidation reaction happening at the in the liver enzymes. The zona fasciculata secretes cortisols, and in a nutshell, the steroidal hormones are released from the adrenal cortex, whereas the medulla secretes norepinephrine and epinephrine, respectively, with the ratio of 20:80. Now, hormones of adrenal cortex are called glucocorticoids, melocorticoids, and they also secrete some sex hormones. It is important to mention that glucocorticoids and mineralocorticoids play a vital roles that help the body in adjustment to the exchanges in the external environment. I mean changes to the external environment, but these changes are within inside the body of the person. Now, this diurnal pattern of uh, ACTH, that is adrenocorticotropic hormones, and you see the peak plasma levels, and there is a once your daily activity in the morning starts, so there is a surge, slowly gradually increase till you reach the maximum of this cortisol as well as ACTH level, and then once you reach your 12 a.m., so there is a decrease in the level of cortisol till you reach the midnight. Here, why it is there is a dip in the midnight? This is important once your person or your patient rather goes to deep sleep. When a person goes to deep sleep, so the level of cortisol falls, and you see when on the very next day then it starts again. So it's a circadian curve or diurnal pattern. In certain books it is written as. So these hormones play a vital roles. Now, uh, what happens uh, when a negative feedback fails? But before going into the details of a negative feedback, there is a feedback system inside the body, and that is there is sinus, from sinus there is hypothalamus, from hypothalamus there are releasing hormones. In case of adrenal cortex, there will be adrenocorticotropic releasing hormones, and in case of then it reaches the anterior pituitary, and from the anterior pituitary there is release of tropical hormone, and that is ACTH, and this goes and act at the adrenal cortex where it secretes cortisol. Now, once there is an increase in level of cortisol increase in level of cortisol, so it will give a negative feedback here to the hypothalamus to decrease the releasing hormone, subsequently decrease the tropical hormone, here in this case is ACTH. So a negative feedback control the systems. When there is a fall or dip in the cortisol level, so through a positive feedback, it gives the information to hypothalamus, anterior pituitary, and to increase the releasing factor as well as the tropical hormone, and thus the level of hormones are regulated. Now, in case of stress, a negative feedback fails. But here are some conditions, clinical conditions, where the problem is where problem happens at different positions, like in case of primary adrenocortical deficiency, which is also called as this is called Addison disease, and there is a failure of the adrenal cortex to secrete cortisol. Secondary adrenocortical deficiency mean due to the inadequate secretion of pituitary gland, there is surgical removal of the gland or prolonged use of glucocorticoids in non-endocrine disorders. So this is also called an iatrogenic disease. And there is tertiary adrenocortical insufficiency or deficiency, so the releasing factor is deficient. So these were some few clinical conditions. While once you are going to assess the cortisol levels, these will play a vital role, particularly the releasing factor. Now in stress, the negative feedback fails. So what is stress? The non-specific response of the body to any demand, and this demand can be anyone. Demand like even demand. This depends on your relation. This may be an unusual demand by a son from the father that he needs a very luxurious car where he cannot meet his her demand. Like it can be an unusual demand from the husband of wife and vice versa. So a stressor is an agent which attempts to alter the internal environment of the body. This may be physical injury, this may be an infection, high or low temperature, radiation therapy, neuromuscular fatigues, and of course, emotions. In this materialistic words, once if we control our emotion, we can control ourselves and many of our unwanted deeds as well. So noise and environmental pollutants are also one of the stressor agent as well. As I said, in the stress, negative feedback fails. So there is persistent secretion of ACTH, and this ACTH acts at the adrenal cortex to persistently secrete cortisol. So what will happen? In stress, there is no dip. This dip will not occur. So there will be a straight level of cortisol, or level of cortisol is increased many folds. And you see, and once the level of cortisol increases many folds, so there will be now the physiological function, there will be no longer a physiological function of cortisol, so it will lead to the hyperfunction of cortisol, and hyperfunction of cortisol will lead to have an increase in the carbohydrate metabolism. These are the physiological effects, but once there is a hyperfunction, persistent secretion of cortisol, so there is an increase in the carbohydrate metabolism many folds, and cortisol also inhibits the glucose uptake. So now the glucose uptake is inhibited, insulin secretion is decreased, consequently blood glucose level will be increased, and once the blood glucose level is increased, this can be very catastrophic, especially in where the lipid metabolism also affects, so it will lead to many triglyceride and fatty acid production. So there is triglyceridemia, increasing the fatty acid level, and of course the hyperglycemia associated with a decrease release of insulin with subsequently increase in blood glucose level. But this is the one aspect. The other aspect is very dangerous, and that is on the cardiovascular and the central nervous system. There is positive inotropic effect on the cardiovascular system, and it is also shorten the PR interval. So shortening the PR interval mean heart rate will be increased. Positive inotropic mean cardiac output and force of myocardium will be increased. So all this will lead to increase in the blood pressure. But this is important. Increasing the sensitivity of the vascular response to adrenaline and noradrenaline is increased. And if this is increased, so it will increase the blood pressure of the person who is under stress many fold. Now this person will be a patient, you see. So blood volume is increased, aldosterone effect is also there, so there may be a steroid induced hypertension, or which is associated with insomnia because sleep is also disturbed, and hyperglycemic like syndrome along with hypertension that develops. So it's a point of concern that uh, uh, we should look into, consider into for proper remedies. And what are could be the remedies? Be polite, be patient, stay around your near and dears like children, family, exercise, hobbies, games like squash where you can use the racket and tennis, or play tennis. Even that could be a table tennis, long tennis as well. So so that you can you can you can just give your catharsis, laugh, walk, and the bold person will be to forgive. I hope you might have understand the biochemistry and the physiological aspect, and as well as associated the pathological aspect of stress. Thank you.